You're listening to Parents You've Got This, the expert guide to parenthood, the complete guide to fertility, pregnancy, birth, baby and parenthood. This podcast is proudly supported by Mistela, a natural origin skincare for babies and children, recommended by healthcare professionals. Mistela by Parents' Side since 1950.
You've tuned in to another episode of the Expert Guide to Parenthood podcast with Freya Owen and Christy Hopwood. We're your hosts and we're from Parents You've Got This, a parenting education business that is designed to help you on your parenting journey. The Expert Guide to Parenthood podcast is all about parenting, pregnancy, postpartum and birth, and today we're going to be talking about parenting and the topic autism. What is it? How may you know if your child has it? And what can you do if you think that they do?
So we are joined by our paediatrician expert, Dr Lexi Frydenberg. Now, Dr Lexi Frydenberg is an experienced general paediatrician working with children and families up to the age of 18. She is a podcaster, she is a mama of 3 and a central part of the Parents You've Got This team. Lexi, thank you so much for being here with us today.
Thanks for having me.
Now, let's talk about autism in the most simple terms. Can you tell us what it is?
So it's not a simple condition, but it's a neurodevelopmental condition, and it affects the way a person experiences, interacts and lives in this world. It's not a disease, it's just a different way of processing and thinking for the individual.
We've read that autism is a spectrum. What does that mean?
Autism is a spectrum, which means different people, children and adults, will experience it in different ways. So at one end of the spectrum, there are those children or adults who will have really strong verbal skills and might have strong cognitive skills, but they have trouble communicating. And that used to be called Asperger's syndrome, but it's now on the spectrum. At the other end of the spectrum, where there's severe autism, there may be a child who's non-verbal, who doesn't speak at all, and who has a lot of trouble functioning in the world around them.
So Lexi, you've mentioned there a few of the symptoms of autism. What are some others and when and how might they present?
Okay, so there are a few really common symptoms that we see in children or adults with autism spectrum disorder. So language is a big feature. So some children may have delayed or limited language, but most will have trouble in how to use that language in conversation, what we call the pragmatics of language. Some children will have difficulty maintaining eye contact. So you might notice that in little children who tend to look away from you or seem to be staring into space when you're trying to have a conversation with them. People may notice that their child's play is different than the other children. So instead of playing together, they may be playing side by side and more interested in the toy rather than the person they're playing with. They may have limited imaginative play. They also may have repetitive behaviour. So say with the toy, if there's a wheel on it, the child may be spinning the wheel round and round. And a lot of children and adults with autism spectrum will have trouble with transitions. They tend to like structure and routine. So moving from one place to another or starting school can be very challenging for those children. One of the other things you'll hear about is sensitivity. So a lot of children with autism will have extra sensitivities to sound. They might find really loud environments a struggle. To taste, so they may be fussy eaters or have a very limited diet. And even textures, so some children don't like tags on their socks or on their undies. So there's a lot of things that you might notice in your child that you think, is this part of normal development? Is this the same as other children? And it's worth having a conversation. But just because your child might have a sensitivity to, something to eat doesn't mean your child has autism spectrum disorder.
Yeah, that's a hard one, isn't it? Because kids can be really sensitive souls. I've got a child that's sensitive about his socks and about some of those routine things, but doesn't necessarily mean that they have autism. How, as a parent, then, do you know that potentially they do? Sometimes maybe it could be something like a milestone. I remember going to the maternal and child health nurse saying, is your child pointing yet? And that was sort of a flag.
Absolutely. So as I mentioned, one of the mainstays of autism is difficulties with language and communication. So if your child's not turning to their name, if they're not pointing, if they're not following a point, if they're not gesturing, if they're not waving goodbye. So it's how they're communicating. So those language and communication and social milestones are really important, and if you're having your regular checks at the maternal child health nurse, they may flag that as a concern. What's important is most children don't have issues with their gross motor or fine motor milestones. So most children will crawl and walk at the same age as other children. Their fine motor skills, so writing and picking up, feeding themselves, etc., is usually not affected. So it's really that social and language communication.
Want some extra tips to help you navigate parenthood? Join a Parents You've Got This masterclass. Visit www.parentsyouvegotthis.com.au and sign up for a masterclass today.
What is the process, Lexi, of diagnosing autism?
I think it's really important for you to get to know your child, start, observing and writing things down, and start educating yourself and doing some reading around autism. There's some excellent resources out there. In Australia, we have the Raising Children's Network, we have Amaze, which was previously called Autism Australia, and the Royal Children's Hospital. So read up about it, know what to look out for, and then start having a conversation. Depending on your child's age, you may talk to your maternal child health nurse if you're still seeing them, and they can just discuss some of the things you've noticed and they notice, and do some screening questionnaires. If your child's at childcare or kindergarten, definitely have a conversation with them about it. And if there are concerns, then seeing your GP and getting a referral to a paediatrician to really start thinking about, what might be going on, and if a diagnosis of autism is sought, how to go about getting that diagnosis.
So is it an age-based diagnosis? Like, can you tell if your child has autism early on, or is it something that you sort of find later on?
Yeah, so it's definitely harder to tell in the very early infancy, but there are certainly features that a lot of people, if their child is diagnosed a bit later in their toddler years, they look back at videos or suspicions they might have had, and there are often clues in that first 18 months of life. So as I mentioned, if a child's not turning to their name, if they're not particularly interested when you're trying to make eye contact with them, if their language is delayed. So there are clues early on in most children, but often it takes a while for the diagnosis to be made, but it's often made in the preschool age.
Once a diagnosis is made, Lexi, what does that mean for the child and for the parents and teachers?
Yeah, so I think it's important to talk about how a diagnosis is made. Unfortunately, like many of our conditions in paediatrics, there's no blood test and there are no scans that tell us. We have to look at other issues that might be affecting the child, like their sleep and their nutrition, and the family dynamics is really important. But if you want to go down a diagnostic path, then there's a few people involved. So one is a speech pathologist, and they will look at what we call the pragmatics of language, on how a child communicates, or even if they're non-verbal, don't have any words, how they communicate in a non-verbal way. So that's a speechy. And then we have a psychologist who will do some formalised assessments for ASD, and then putting those pieces of information together from the speechy, from the psychologist, usually we have a hearing tested and vision tested in a child, comes together to chat with the paediatrician, who they may have seen before in most instances, and then we discuss whether we make a diagnosis of autism spectrum disorder and what that means for the family.
Yeah, what does it normally mean in regards to treatment options, or is there a treatment for it?
So I think it's really important to think about why you want to go down that diagnostic path, and often for parents it's to try and understand their child so that they can read more about it, educate themselves, hear from other parents what works and what doesn't work. It can be really helpful for teachers as well to understand that child, the child themselves if they're older. It can help them go, why am I a little bit different than some of my other friends, and sort of see it as a strength, not necessarily as always the child who's having difficulty. So it can be helpful for the parent, the child and the teacher, but it also is helpful because we can put in place early intervention. So early intervention is when we get our allied health team, usually early, to try and help children, autistic children, with some of the difficulties and challenges they face. So a speech pathologist may help them develop language or non-verbal language or other ways to communicate. So in our severely autistic children, they may have communication devices as well as a means of communicating. We have psychologists who can help us with the behaviour and emotional regulation and helping what we call some of the comorbidities. So if a child has anxiety or ADHD, attention deficit hyperactivity disorder, the psychologist can help them manage that. There might be an occupational therapist who's involved as well with the emotional regulation and particularly with social skills. So they may have individual social skills classes, or they may have groups in school or outside of school to help with social skills. And I think don't forget parents. I think it's really important for parents to, one, be able to get education and understand the spectrum of autism and how that relates to their child, but also to help them find their tribe. So,
Yes.
the other support people, other parents, teachers, allied health professionals, and just have a team around you, I think is really helpful.
Lexi, I love what you're saying there about parents, because we're not in it alone. There are these amazing organisations and support networks that are there. That said, what would be your top tips for parents if they've got a diagnosis for their child with autism?
Yeah, look, I think it's about really understanding what that means. So meeting with the therapist, the psychologist, speech pathologist, paediatrician, often several times to understand that report, because you'll get a long report and most parents read the summary and just go, this is just overwhelming. It's really important. With time, it might not happen straight away. You may be in shock or grief or whichever way you're processing this, but in time, really understanding what the report says and what it means for your child.
Yes.
Understanding your child, because in the end, you're going to be your child's best advocate. There are these allied health professionals and there are teachers who are on board, but you're going to be the one along your child's journey to help and support them. So really just trying to understand how you can help your child in this moment, in this year, at this time. I know a lot of people start thinking ahead and thinking, what's this going to mean for my child as an adult? I often tell parents, it is tempting to go there, but really let's try and focus on the here and now, what you can do this week, this month, this year to support your child, their other siblings if you have a family, and, the friends around you as well.
Well, Lexi, thank you so much. As always, you're such a wealth of knowledge and our community is so lucky to have you. The Expert Guide to Parenthood podcast is all about parenting, and so we want to know what your questions are. Do you have any questions for us, any episodes that we haven't covered? We have covered a lot, so do check out our incredible Expert Guide to Parenthood library. There's other episodes in there with Dr. Lexi.
A huge thanks to Mistela for sponsoring this episode. Mistela empowers parents throughout their parenting journey with education and honest conversations from pregnancy and beyond. Mistela has plenty of parenting articles and resources on their website. Visit mistela.com.au.
You've been listening to the Expert Guide to Parenthood podcast, and never forget, parents, you've got this.
Join a Parents You've Got This masterclass today to be prepared, excited and educated for pregnancy, birth, baby and parenthood. Visit www.parentsyou'vegotthis.com.au and sign up for a masterclass today.
The information provided in this podcast is general in nature and is intended to support, not replace, a discussion with your doctor or healthcare professional. Parents You've Got This take no responsibility for any medical decisions made by individuals based on the information provided in this podcast.